Hello there, and welcome to Level 5 Health and Social Care, Unit 504, Partnership Working. And we're now looking at week 4, the last week of the unit, and we're going to look at the final criteria, which is to evaluate the impact of partnership, and then we're going to do a little overview of the assignment. Okay, so the objective, this last objective in task 3, is basically 3.2 to evaluate the positive impact of working in partnership. They want you to evaluate it. They want you to focus on the positive impact of working in partnership. But because it's an evaluation, you do need to put some negatives in, okay? Because otherwise it wouldn't be a full evaluation. It would be just describe the positive impact. Okay, so you need to have a few swings and roundabouts, and because it's evaluate, you need to think about some examples as well. Okay, which hopefully might be able to pick up from resources. So what I'm going to do is just an overview, because this sort of last criteria tends to consolidate really the whole idea of working in partnership. So I'm going to just sort of like review it a little bit as well. So starting off, why would we work in partnership? It can contribute to the improvement of the service provided. It can turn out that limited organisations of a resource can be used to reach a bigger number of people, because you're not repeating what you do. You're not wasting time and energy doing something that somebody else has already done. So it's about making sure that resources are used properly. A partnership is formed between individuals, agencies, or organisations, and there needs to be a shared goal or interest. There needs to be a point of the partnership. Okay. A coherent and effective service, or a shared culture, or prompt responsiveness. Those are the things that deliver the best outcomes. So partnership working, I suppose, obviously follows the concept of a collaborative approach. And it does make a difference in the work environment. Working together, and I'm sure those of you who are in work placement can think about where you've worked together with another team member, just simply. It doesn't have to be even another professional, could be another team member, and how that maybe solved a problem, reduced time and energy on something, made a bit of a difference to your work environment. And it can help your business, your organization to grow. And it also, partnership working does create a sense of community amongst the staff. It makes you feel that you're all in it together. You're part of a team, and that feeling of being in a team can actually bolster people. When you have rotten days and things don't work very well, or when you sort of know that someone is earning a heck of a lot more money than you for doing what you might think is an easier job, that teamwork and that partnership working can actually give you a stronger sense of community and feel quite good about what you do, because you've got somebody there, justifying that you've done, you do well and what you do is important. It can also lead to improvement of efficiency, and it can improve quality as well, because people are throwing ideas around. You'll be able to pick the best one and you'll be able to discuss it. So to do this, we need to think first of all, what are the benefits of working in partnership, especially as our criteria wants the positive outcome, really. So let's think about what the benefits are. So how does it develop? How does it deliver better outcomes? It becomes difficult sometimes for a single person to do everything due to time restraints. They might not have the experience, they might not have the expertise. Or their job might just need a second person. So if you're lifting someone, hoisting someone, you might frequently need a co-worker to be with you. So it's a partnership. For example, an example I've got here is safeguarding children. The safeguarding officers need to speak to all the other professionals, as we know, we talked about in last week's PowerPoint, such as the police, social workers, videos, or teachers to discuss. And on their own, they don't get the full picture. So it goes from you working with your co-worker to working with other officers, other professionals from external to create a bigger picture. Either way, it's as and when is necessary. So I've looked about the following sectors, and I've kept it sort of down. There are others. I mean, the business sector, of course, works in partnership a lot, but I've tried to keep it down to ones that you'll be coming into contact with in this role, and what's important. So if you work in a health and social care field, what's important about working in partnership? Information sharing with patients becomes convenient. It improves the monitoring of a difficult patient if you're all sharing it, and it's not just relying on one person, and when they're not there and something doesn't get monitored. Reduces duplication of assessments and services, develops a multi-skilled workforce, creates a better understanding of team roles, so therefore people can contribute to care in a better way. And as I said earlier, it improves job satisfaction. So if you've got volunteers coming in, if they partner, they work in partnership or they're part of the team, they'll get a lot of satisfaction out of it. But also so with other professionals, especially those peripheral professionals who maybe work on their own a lot, like community psychologists, community physios who might just come in now and then. But if they're embraced as part of a team in your organisation or your care home, say, then that can improve their job satisfaction. And if you're connecting with people who've got loads of other interesting expertise to bring you, and you can learn from them, that will also improve your job satisfaction as well. Also, in the social work teams, how does it work for them? It allows team members to bring their individual expertise. So, again, it's people with different backgrounds, different knowledge. They may have worked on different cases in different jobs, so they can bring that sort of forward. Allows different professionals to present ideas that create opportunities for innovation. This isn't just down to social work, actually. This would work across health and social care as well. Clients benefit from have a larger support system. So they're not just at one-to-one, and then um, if Mary isn't around, then they have to wait until she's back on shift or something. They can speak to other people and know that problem will be shared to the team. It gives access to different tools that reduce costs and ensure that the team performs efficiently. So there may be a social work tool that would be really useful for the healthcare workers or for the care workers. So they might bring things in and save you having to go out and buy something new because the social worker's already got it, she used it elsewhere and she's brought it in for you. It becomes easier to navigate bureaucracy and protocols and procedures with team members who have existing relationships. So if a social worker, again, is working with a health visitor, then the health visitor can say, oh, it's okay, I know how to approach this. I know how to manage the bureaucracy in primary care because I see them every day. So don't worry, I can speak to so and so and I can get that happen. And it would be the same for you if you're a care worker. Your social worker could say, don't worry about that. Yes, this is how we do it in social work. This is who you have to speak to. But don't worry, I can go and do that as well. So it's helping you navigate some difficulties. And the other team is safeguarding. Obviously, the safeguarding team, it's fully partnership. We know that. We talked about that quite a lot in week 3. I know that you're aware that there are a lot of protocols that are safeguarding that are put in place by legislation. They're the only ones where the partnership is actually legislated. But they really should act as a sort of standard for other teams as well. So it leads to early effective risk identification. It improves information sharing. We know that's been an issue. We talked about that last week. Allows joint decision making, which is a much more informed way of doing things, because you've heard the different approaches from the police, from health, etc. Encourages coordinated actions to assess and reduce risk. And again, people bringing in their different backgrounds might have an approach that you hadn't thought of, to reduce risk. And the police are pretty good to say, well, actually, you can't do that because it's illegal. They're always useful for that. So it sort of, it enables people to work out best practice, really. So we've had lots of reasons and positives for working in partnership and how they are positives for different groups of people. I've just, as I said, I've just got a page of drawbacks for you, but they're the same drawbacks that when in your level 3 and 4, when you looked at teamwork, they're the same sort of issues, really. So, but I still think they're worth mentioning. Though the benefits do outweigh the drawbacks, and I think there's plenty of research to support that. And if you want to, you can find some, and as long as you cite it. Some issues can hamper workflow. There may be disagreements while people are making decision, or we might not come to a decision, but you might have set an hour aside for this meeting, and when you get to the end of it, you're still arguing about it. So that could mean that you might have to have further meetings to come to a decision. So that, that can be a problem. And some people can actually leave the decision making process a bit disgruntled that the decision didn't go the way they wanted it to. They might have got outvoted, and it might be fairly legitimate. It doesn't make them feel any better. Decision making process can become time consuming because it requires the consent of all partners or colleagues. You might be able to resolve that by, having a majority vote thing. But it could be difficult if the police say, I'm sorry, we just can't go along with that. So it can become a complicated process. Conflicts might arise due to disagreements. There may be a conflict, but they could be left behind. It's about sort of developing relationships that are good enough that even if you have a conflict over one case, that you don't take it on to other cases. And maybe if you do that, people should be comfortable enough to draw that to people's attention. Each member remains liable for their own actions. You are still liable for your own action. You are still, even if a vote was taken, you are still responsible. And I guess if you feel, if something, if they're wanting you to go against your code of conduct, you would need to go and discuss that with senior management and just say, look, I can't go with this decision because it's breaching my code of conduct. So, you are responsible for your own action. If you say, I'm sorry, I can't be part of that. And you're also, if you've made a decision you want other people to carry out, then you're responsible for making sure and agreeing that they aren't breaching their codes of conduct as well, or doing anything that's illegal or immoral or inappropriate. So those sorts of things, as a team, you're responsible for each other. And you might lose autonomy. And lots of people love their autonomy. They like making their own decisions. They like doing things their way. Some of us are control freaks. That's the truth of it. And that's quite difficult if you're working in partnership. You have to swallow that a little bit, and just sort of think, well, I'm not really losing my autonomy because I'm equal to everybody here. So I'm making a vote, I'm making a group decision. But some people might find it difficult, if they've worked for years where they've worked independently and they make their own decisions, having to have a shared decision. Some might feel it might be a step back in their skill, but it isn't actually. It's just, it has to be acknowledged that when you're working holistically for someone, group decisions are the better way, really, because you could be wrong. And when you're actually, if you sort of go back to the child abuse issues of last week, then when you're wrong, there can be a very high price to pay. So people need to think about that. But yes, that can be an issue for people. Okay, so that's a little bit of how to evaluate, really. It's fairly straightforward. You've had lots of research and resources to back that up. So you can bring examples from that about where things didn't work, and that would sort of help you say as part of your evaluation, yes, this is right, but okay, it didn't work here, but not because it isn't right, but because they didn't do it very often. Okay, so you might want to think about that. So have a look through the additional resources that I've provided. I've provided a couple of other documents for you. Do a bit of research on your own and try to find some examples of positive impact of partnership working from the case studies. One of the articles I sent you has got some case studies in it. You might want to have a look at those, and you could use those as examples. And if you do any wider research on, if you could bring a case study in. But bearing in mind you're only working with a certain size word count, so you can't explain the whole case study. You might need to synthesize it down to a couple of lines. Okay. Don't forget any examples you do bring in, especially if it's from someone else's research or someone else's document. You must use the citation. Okay. And that's pretty much the end of the teaching part of it. We're going to go on now and just review the assignment. So it's a quick overview of the assignment. Okay, before you start your assignment, do remember this is a level 5 assignment. It's equivalent to the second year of an undergraduate degree, and it really should be reflected in the quality and quantity of your written work. So it needs to be, you've got a higher word count than the assignment you're handing in for level 4, and the quality needs to go up as well. Okay, so please bear that in mind. All of your sources should be cited in text. This should be, for a level 5, you should go without thinking about it. There should be a full reference list at the end of the assignment, and it should be in proper Harvard format. You really need to be able to do this by now. Most of you do, I know, but just make sure. Don't forget the citations in the text as well, and don't forget to put them in the right format with the name and the year. Do not use criteria as headings. I know you've done that in previous levels, 3s and 4s, but if you're going to use a heading at all, just use task numbers, okay? And you make the criteria flow from one another right within your paragraph. I will find the criteria, okay? Make sure you've addressed it correctly, and make sure your paragraphs flow well from one to the other. So you're actually treating them as just new and interesting points to that task. Okay. So any problems with that, if you're really not sure what I mean, come and, WhatsApp me and speak to me. But I do not want to see criteria, a few lines, criteria, a few lines, criteria, a few lines. I will mark you down on presentation for that. Okay. Please remember that now, because we're at level 5. I want you to try to bring in examples of wider reading to demonstrate added depth to get a better grade in that area. However, don't forget they have to be relevant, so don't go wandering off the topic. Okay. Do remember, if you're bringing in something, like, just keep checking back when you're doing a bit of research. Think, is this exactly what the question's asking me? And do what the command verbs tell you. If they want you to describe, describe. If they want to evaluate, you need to do a bit more. Okay. If they want it to be critical, well, the word critical means what's wrong with it. So pick up the problems. Okay. So be specific. Now I'm going to go on and we're going to look at the different criteria. So task 1. The whole of task 1 is addressed in week 1 PowerPoint and resources. Okay, so there's 2 criteria you're going to address. And the main overview of task 1 is to explain philosophies and relationships in health and social care working. So first of all, we want you to have, what is the philosophy behind working in partnership? So go back to your video lecture in week 1 And just, you only have to explain it. So just give me some ideas behind working in partnership. What's it all about? What's the philosophy of it? And then what are the potential barriers? And we've addressed that quite a few times in different areas. So you should be able to find that, but it's very clearly highlighted in part 1. And again, any of your resources that gives you a sort of a case study where it's gone wrong, or anything you pick up from your other reading, don't forget to cite it, but any examples, of course, will get you a higher grade. So what is the philosophy? What does it mean? What does partnership mean? Why do we do it? What are the barriers? Okay, that's task 1, 600 words. Keep to the word count. Try not to go over. Remember, at level 5, I've got to keep you within the rules. So no, any more than 10%, I will also downgrade you on your presentation. Task 2, 800 words. It's larger. It's got 3 criteria to talk about. So you've got to divide it up as well. The overview of task 2 is to critically explore how to promote positive partnership working. So you need to find out how you're going to promote positive partnership working, but you need to be critical about it. 2.1 is critically explore the role of interprofessional learning. And 2.2 is critically explore the concept of communities of practice. And they're available in week 2 video lecture and resources related. So critically explore, so find out, you can tell me about it, but you need to be critical. So, if there are any negatives that you pick up along the role, bring them in. What is the role of interprofessional learning? So tell me about what happens. How do you do it? Okay. What's expected? Now, 2.2 is to explore the concept of communities of practice. So it's not about how you do it. It's just about what is it about? What does it mean as an idea? Okay. So you're talking about it at that level. And again, critically explore. You don't have to just give me the positives. Most documents give you only positives about both of these two. But any areas where you can sort of see a bit of criticism, really, or it's a bit idealistic or lovely if you've got the time, all those sorts of things. But try to pick those up. So they're, as I said, they're all addressed in week 2 PowerPoint and resources. Now, 2.3 is addressed in week 3 video PowerPoint resources. Just because they were all too big, I didn't want to put this one in that week because I just felt it would be too long. But remember, you're writing it in task 2. So you have to go to week 3 for it. It's the first half of week 3, but you're writing about it in task 2. And this is just explain. So just tell me about personal budgets. What are they? How do they work? Give me a nice overview of them and their impact on working with service users. So really important, this bit. Don't just give me the first bit. Don't just explain personal budgets, but tell me how that affects that relationship, that partnership working. So say you as a care manager or you as a carer, how that affects your partnership. If you give over the personal budgets and they're paying you, how does that affect your partnership working with a service user? And give me some ideas, some insights. And again, if you can find some bits of research on it, or if you find some advice on it, but you can also express some of your ideas and thoughts and feelings. But if you can give me an example with a citation, that would certainly take you up into the higher level. Okay. So that's task 2, 800 words. Again, try to stick to the word count. Finally, task 3, the overview of that is just to evaluate the outcomes of partnership working. But 3.1 is asking you to talk about the child abuse inquiries. Now, I don't want you to go into any detail about the individual child abuse inquiries. I have mentioned some for you. The most you need to do is you can mention the odd name if you want, but do not tell me about them. Do not get sidetracked into writing about the individual cases, okay? Because that would be not good. Just the impact. So when these cases hit, they basically hit the newspapers. People got extremely upset, yelled at the government, as you can imagine. So it was the impact of these child abuse inquiries on government thinking. Now, what you know is they either got a report written, such as the Lambing report, or they developed the working together report, and then various child abuse inquiries caused the working together guidance to keep being reviewed right up until this year. Okay. You don't need to give it to me step by step because you don't have the time. You don't have the words. So unfortunately, you're going to synthesize it down into some directional points, really. So evaluate the impact. How much did it affect? Did it affect it a lot? Yes, because these special reports were created. But on the other hand, no, because the improvements didn't happen, or a little bit of improvement happened, but not a lot. So just remember to make those points, okay? What happened on the government thinking? Well, basically, after the reports, the working together document, first of all, was introduced, and then it was reviewed after every report review, particularly the Lambing reports. Okay, that's important for you to think about. The final Lambing report, the most recent working together review. And again, you can just pick up some highlights about the working together guidance. You won't have room to write a lot, but just give me. But remember, you're already focusing on partnership, and those guidances are absolutely enormous. So just pick a couple of points. Lambing brought up this point. Working together did this. Okay, that's showing the impact. Evaluation is halfway along. Well, no, it didn't work because we still needed to do more. We're at 2023. The new one's just come out. Sorry, we're at 2024 now. The new one's just come out. I have not seen a review of it yet. I don't think it exists because it's fairly fresh. Okay. So that's in week 3. If you want to go back to week 3, look at your resources, look at your video PowerPoint. Okay, you should be able to find that. And finally, 3.2, which is the other part of your 600 words, you could probably write a bit less on this one, I would have thought. Evaluate the positive impact of working in a relationship. So we've just looked at that at the beginning part of this video PowerPoint. So what you need to do is just to highlight some points about the positive impact of working in partnership. It is an evaluate though, it's not just describe or explain the positive impact. So you do need a little bit of critical. Okay, so if you can pick up a few negatives, pop them in. I did give you a page of negatives. So, okay, just bring those in. And again, if you want to use a couple of examples of where partnership working has been effective and good and had a positive impact, there are some case studies in this week's resources. You can just pick 1 or 2 of those, depending on how much words you've got left to do. Remember, stick within your word count. Don't forget your referencing. Okay, well, that's it, really. So good luck with your assignment. WhatsApp me or WhatsApp the group if you want to discuss anything further. Okay, and I will see you in the next unit. Okay, thanks and goodbye.